Anne Rimoin is a professor in the Department of Epidemiology at UCLA Fielding School of Public Health. She joins me now from Los Angeles. Good to see you. Just among my own circle of people, there is confusion about boosters. I think it's because it seems every other day there's a report, we need them, then another saying we don't need them, and then another one saying we will eventually. What's your read on the data?
Well, Michael, I think that there's a lot of confusion because there's so much data that is emerging right now, and the messaging is a little bit confusing. So what we know is that we're seeing from several studies, and in particular studies from Israel, that we're seeing antibodies decrease over time and infections becoming more common, in particular in older individuals who are having more severe disease. And that is a real indication of having waning immunity, that the immunity to the virus is now decreasing over time. And that's something that we had always said was a possibility, that we were giving 2 doses a few weeks apart, and that there may be a need for a booster when we would start to see more cases coming over time. So I think that that's the real key here, that we've seen evidence of waning immunity, in particular with the Pfizer vaccine in Israel, and that's where this impetus to start boosting, looking at countries that are ahead of us.
So what would you say to people who have 2 doses so far and no booster? What do you tell them if there's efficacy concerns?
Well, what I think that there are a couple of pieces to unpack here. The first thing is that we're talking about this as boosters, but really what we're talking about in reality is having a 3-dose vaccine. And this is because we're starting to see the need for a way to be able to keep these antibodies up, to be able to really get a boost of neutralizing antibodies. And this 3rd dose is very likely going to provide longer term immunity. Now, we don't know for sure because this is still all ongoing. We're still learning about it, but that's very likely. And that's what we see, for example, with a hepatitis vaccine. And so it's very likely that this is just a 3rd dose to be able to boost your immune system. In terms of efficacy, these vaccines are all doing an excellent job of reducing severe disease, hospitalization, and death. We have to remember, you look at those numbers, who is being hospitalized, who's dying. The vast majority of those people are unvaccinated. It is very, very rare for somebody who is vaccinated to have one of these very severe outcomes. So the vaccines are really holding up well. It's just that we're starting to see a lot of these, what we're calling breakthrough cases, people who are fully vaccinated getting infected, but they're not getting severely ill. So we have to really think about, what do we want these vaccines to do? We want to keep people out of the hospital and from dying, most importantly. But if we can really get ahead of this and give people boosters or 3rd doses to be able to prolong this kind of protection, that's a really great thing.
Yeah, we already seen increases in cases in kids in areas with low vaccination rates. So I mean the fallout from being unvaccinated, it couldn't be more clear. So just quickly, if we do get these 3rd doses, boosters, should it be with the same vaccines, and should the timing be oriented towards more of what the variants are doing, what's out there, their effect, and so on?
Well, I think that it's really about having this 3rd dose, approximately 6 to 8 months later, that's going to provide this kind of longer term immunity. We hope, whether you get the vaccine that you started with or not is really something we should be basing on data. And right now we don't have that data. We know from these Pfizer studies that we're seeing that the 3rd dose of that Pfizer vaccine is going to significantly increase the antibodies and these neutralizing antibodies that will provide protection. But I think that these studies are ongoing. We are going to have those data. And so whether or not you want to mix and match vaccines, we can learn about that later, but my guess is that those differences are going to be incremental, that the real benefit is just going to be having this additional dose 6 to 8 months later.
Yeah. I guess the lesson is the damage done by bad messaging. Great information from you, though, Anne Rimoin. Thanks for clearing things up.
My pleasure. Always a pleasure to be here.